Hi, my name is Gabriela Espieso and I'm going to talk about failure to thrive. Definition: failure to thrive refers to children whose current weight or rate of weight gain is much lower than the other children of similar age and gender. The causes: we have problems with genes such as Down syndrome, organ problems, hormone problems, damage to the brain or central nervous system, which may cause feeding difficulties in an infant, heart or lung problems, which can affect how nutrients move through the body, anemia, and other blood disorders.
Failure to thrive. Learn what is being done about it and learn what you can do. What is failure to thrive? Well, it's a set of conditions. It's probably not a diagnosis, although some doctors will say it's a diagnosis, others will say it's not. It's just a description of a particular set of conditions. Generally speaking, it's low growth markers. That is, a child is lower than the fifth percentile, less than the fifth percentile in height, weight, and head circumference of all other children in the country for the same age. Um, in many cases, a child with failure to thrive is behind in developmental steps. Now, the medical approach will start with that because that's where most parents end up taking their child first when they know something is wrong, or the doctor may discover it in a well-behaved checkup. The doctor will do those measurements, see that the child is low in the lower than the fifth percentile, and some doctors even is lower than the third percentile. The first thing they're going to look for is it a biological problem, and they're going to look at things like is food entering the system. A child with a cleft palate or a cleft lip may have difficulty eating and drinking appropriately. So the first thing they're going to do is check is food entering the system, and is food moving through the system, and that relates to is there a blockage in the esophagus and the stomach and the intestines? Is nutrition poorly absorbed? And they'll do some measurements about that. There's a lot of medical conditions which can affect and cause this failure to thrive. There are infections, tumors, diabetes, heart or kidney disease. So the doctor's first step is to make sure that it's not an organic problem. Now, an organic failure to thrive is sort of failure to thrive medical, is that it's some kind of physical medical problem. The doctor will be able to deal with that, and that usually just has the simple failure to thrive FTT designation. The non-organic failure to thrive is when it's a non-medical problem, when the doctor doesn't have something that the doctor can prescribe to do. And that's NOFTT for non-organic failure to thrive. Now, the psychosocial approach is that you have to look and see, does this child have access to food? Is there food available? And what's the nutritional value of this food? Some families may not have money and there's no food on the table. Or there may be some inappropriate parenting and they don't provide food. So parenting is looked at, and they also look at under parenting, is there appropriate stimulus for the child? Is there abuse for the child? is that affecting the child's ability to take in and obtain nutrition from food? And also, there's another piece about the emotional state of the child. Some children, because of psychological interactions, are rejecting food. They won't eat, or they'll eat and throw up, and it's not a physical problem, it's more of an emotional problem. So now the sensitivities and intolerances approach is a relatively new area.
Issues applied in medicine. Diagnosis. If a baby doesn't gain weight for 3 months in a row during the first year of life, doctor usually become concerned. Doctor uses standard growth chart and to plot weight, length, and head circumference, which are measured at each well child exam. Children may have failure to thrive if they fall below a certain weight range for their age or fail to gain weight at the expected rate.
You will often hear your doctor say words failure to thrive. And failure to thrive really means your baby is not putting on weight. And that can be extremely dangerous in a newborn. The way to spot it at home is to notice if your baby is not eating, not finishing feeds, and really not gaining weight. If you're concerned, you can buy a scale and measure your baby, or you can take your baby to your doctor as many times as you want to figure out if they're gaining the appropriate weight they should from the hospital. Typically, babies will be born at their birth weight, drop a little bit of weight when they leave the hospital, and then gain weight at a rapid pace. If you're noticing that your baby is not gaining weight and not finishing their feeds, you really need to go to your doctor and check them out and figure out why they're not thriving. And is it they can't tolerate the food, they can't keep the food down, or they don't want to eat? So it's really important to monitor that and be in close contact with your doctor.
Treatment. Usually, kids who have failure to thrive can be treated at home along with regular doctor visits. The doctor will recommend high-calorie foods and may place an infant on a high-calorie formula. Depending on the child's feeding habits, doctors may recommend offering foods of certain texture, spacing out meals to make sure children are hungry, avoiding empty calories like juice and candies, and other strategies depending on the child's condition and family situation.
Welcome back. Most babies steadily grow and gain weight, but in some cases, children don't meet what are considered to be normal standards. In tonight's Baby Your Baby report, Christina Flores takes us through what it means for a child to be diagnosed with failure to thrive and what can be done about it.
He's only gained about 4 pounds since birth.
5-month-old Phoenix was diagnosed with failure to thrive because at 2 weeks old, he was not growing as expected.
They're below the curve and they're following the curve. That's a normal growth pattern. Where we get concerned is kind of if they've established a curve and then they fall off.
Many things can cause failure to thrive, including illness and eating problems.
Right, well, that's the most common cause for it in children, probably 80% of the time, is just they're not getting enough nutrition or enough calories.
With baby Phoenix, Dr. Sutton began a quest to figure out how best to increase the number of calories he was consuming.
We started out just taking him off breastfeeding to see if he was allergic to the breast milk.
But that didn't fix it.
We added more calories into his formula, so we started at 24 calories, and then we went up to 26 calories, and then we went up to 30 calories with microlipids.
And still, no answers.
We're doing everything we can. We're doing everything the doctor says.
The biggest concern with failure to thrive is how it can affect a child's brain. In the first year of life, a baby's brain doubles in size.
If you're not getting all the micronutrients and other nutrition that you require during that period, there are studies that suggest that your brain can be permanently affected. So it looks like he's been doing really, really well.
For Phoenix, the goal is to keep trying different formulas and methods until he returns to a healthy and normal growth pattern.
So it's been hard to worry about him every day, but he's a really happy baby, which makes it a lot easier because he's not crying all the time in pain.
Christina Flores, 2 News.
One of the most important keys to treating failure to thrive is to recognize the symptoms as early as possible. That way, doctors can begin treating the symptoms right away and work the child towards returning to that healthy growth pattern.
Conclusion. It is most commonly used to describe a failure to gain weight, but some providers have also used it to describe a failure to growth or a failure to grow and to gain weight. It covers poor physical growth of any cause and does not itself imply abnormal intellectual, social, or emotional development, although it can subsequently be a cause of such pathologies.
There's a couple of terms that used in private practice. One is failure to thrive. What is failure to thrive?
Failure to thrive is when a patient doesn't meet their growth potential. They usually are falling off their weight and or their height curves at least two percentiles.
So in other words, if a kid is growing at the 50th percentile of weight, drops down to below the 25th percent, because you go 40, 25th, it's a little bit of a red flag. Is that correct?
Yes.
And if we get down to a third percentile, that's big problem. Is that correct?
Especially if they're growing at if they were growing at the 50th percentile, because then what will happen is the poor weight gain will impact on their ability to grow in length.
It affects the whole body, function, intelligence, and everything. So in other words, if a kid's growing at the 5th percentile all the time in weight, that is just a small kid weight-wise, but it's not failure to thrive. Is that true?
Right. A failure to thrive would be somebody who's actually fallen off their already established weight and height curves.
And the one exception would be a child that just doesn't gain weight from birth.
Usually they'll be following their own curve, even as you mentioned, even if it's the 3rd percentile, they'll usually follow the 3rd percentile. They'll follow their own curve, they won't fall off of it.
What are some of the most common reasons for failure to thrive?
The most common reasons are inadequate calorie intake. That can be due to emotional reasons, it can be due to behavioral reasons. The medical reasons that can cause failure to thrive include things like cystic fibrosis and celiac disease, problems in absorption, problems in usage of the energy that you're taking in, and malabsorption.
Okay, there are some conditions that doctors pull out of their head, but has to meet the criteria. It's a kid that was growing at one rate and decelerating by at least 2 standard deviations. Is that correct?
That's correct.